Do you get to do what you'll learn in the LPN program? I heard that most things that you learn aren't common since usually practical nurses get jobs in nursing homes and pretty much just babysit the elderly. Maybe you'll use your basic physical checkup on them, but not more advanced things that you learn. Keep in mind, this is just what I heard and how I heard that the career goes. Hey you guys, welcome to my channel Nursing with Key, where I make a whole bunch of nursing related videos sharing tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. In this video I wanted to address a topic that I see a lot in my comments, and that is where LPNs, practical nurses, are able to work. I don't know what it is, but there's this kind of rumor going around saying that practical nurses are only allowed to work in nursing facilities, and that hospitals are not hiring practical nurses. And so I wanted to start a series called Breaking the LPN Myth. So there are so many rumors that I have heard about practical nurses, and I think that it's about time that I get rid of those rumors and clarify everything, because there are so many people who are either thinking about going to the practical nursing program or who are in it, and they are getting very discouraged. Some people are considering dropping out of their program just because of all these rumors they're hearing, and hearing that kind of breaks my heart, and I really don't want you guys to give up. I really want you guys to keep pushing. So today's video is going to be about where LPNs are able to work. I'm probably going to make another one tomorrow. I'm going to try to make at least 5 in a row, one every single day. But if you guys have any other video suggestions or questions about any type of rumor or anything that you heard about LPNs, leave them down below and I will be more than glad to answer your questions for you if I can. I am very well aware that over 70% of my viewers and my subscribers are Americans. Now, for those of you who do not know, I am not an American. I am a Canadian living in Canada, okay? So the rules are a little bit different. So our schooling is a bit different. In Canada, there is one province that has ADN or ASN nurses. In the rest of Canada, in order to become a registered nurse, you have to go to college for 2 years to become a practical nurse, and followed by the practical nursing program, you can do a 4-year program. No, actually they cut a year if you're an LPN, so a 3-year program that allows you to become a BSN. Or if you want to, you can go directly into it if you have all the prerequisites. So we do not have ADN or ASN nurses, which allows LPNs to do a little bit more, since not everybody has the funds to go do a BSN and not everybody wants to go do a BSN. So a lot of people kind of just go to college, they become practical nurses, and they're okay with that, because in most provinces in Canada, practical nurses are paid very well. If you guys have not seen my how much I make as a CNA video, definitely go check that out, just so that you guys see how much I'm making as a CNA. There are some people who are in the States who are offered how much I'm making as a CNA as an RN. So most LPNs are well paid, and yeah, after college, some people don't want to go to university. They just want to stop at college. So I just wanted to clarify that. So where I live in Canada, like I said before, but I do have a lot of family members in the United Kingdom who are also in the medical field, and I do have a couple family members and friends that I know in the States who are nurses. And I think that based on what I heard and based on my research, when it comes to where we can work as practical nurses, it's pretty much the same everywhere. The schooling is different, but after graduation, when looking for a job, usually things are pretty much the same everywhere. But I'm going to speak about for here. And for here, LPNs are able to work in so many different places. However, it is a lot easier for practical nurses to get jobs in residences, because when RNs graduate, I've never really met an RN student or an RN who ever really wanted to work in long-term care facilities. A lot of you, like, you just graduate, you just learned how to do IVs and all these stuff, and you kind of just want to go in the hospital and you want to feel that fire, that adrenaline rush, and you don't really get that in residences, because it's the same people, same time, same medication, same every single day. So not a lot of RNs want to go work in residences. Most of the time when RNs work in residences, it's either RNs who have been RNs for so long and who are kind of just tired of the hospital, and they want like a more chill job where they don't really have to think too much anymore because they've just been burnt out by the hospital, or new grad RNs who are just kind of stuck there until they're able to find another job. So they kind of, if they're offered a job at a residence, they might just take it while they look for another job. But I haven't really met much RNs who want to work in the hospital in a residence. Now LPNs are getting supervisor positions and they are getting hired a lot more in residences because of that, right? If there are no RNs, well, they're gonna need LPNs instead. And since in residences, not a lot of people, like, you rarely ever see somebody on IV medication in a residence. Most people take oral medications. They might take pumps. You know, you might have to give them an injection or whatever, but LPNs are able to give all types of medications other than IV medications. We can only give IV fluids. So in a residence, we don't really need to work with an RN because we know how to do an assessment. We know how to chart. We know how to give all the medications. We can handle it on our own. So it's actually cheaper for the residences to pay us. Since we are LPNs and we are entry-level nurses, it is cheaper for them to pay us, and we are able to work with our RNs. So residences are saying, well, hey, we get the same job and we get to save money. So yes, it is true that LPNs are getting hired a lot more in residences, but that doesn't mean that we can only work in residences. Now, I'm a CNA. Like I said before, I work in a hospital. I work in a hospital with practical nurses who went to the same school as me, who were probably one class or two classes before me. And I work with them on the same floor as them. They're the one delegating to me. They're the ones working with me, and I see everything that they do. And since I work in a hospital, I am being trained in every area of the hospital. So far I've worked at the chest institution over here where I live, and basically it's people with severe respiratory problems. So they have machines breathing for them, and you know, they are constantly on oxygen and things like that. I've worked in a very small long-term kind of floor that we have, and I still have to be trained in emergency. I still have to be trained in med surg. I still have to be trained in ICU as a CNA to provide, you know, hygiene care and do ADLs and stuff for people like that. And I have kind of met a lot of the staff. I visited emergency. I visited ICU. Like I said, I did RESP, and I did long term, and I've seen LPNs on all of those floors. One LPN, one RN, always teams together. And usually there's more than, like, because there's like 4 wings on each side, on each unit. So for each wing, there's one RN, one LPN, and there's like different teams. So you might have 2 teams per wing. So you have 4 nurses. So 2 LPNs and 2 RNs team together. They're always team together, always working in a team. You see LPNs doing every single thing that we are taught in school. I've seen them in Emerge, and I've seen one in ICU. And ICU is the only exception. And the only reason why I say that is because of this. Most of the people who are in intensive care units are on IV medications. They are most likely going to be on IV medications. Sometimes you see people on multiple IV medications at once. And since it is not in our scope of practice to give IV medications, it can be a little bit harder for an LPN to get a position in an ICU. But that is pretty much the only exception. I actually have a friend who graduated from my school 2 classes before me. So she started a year before I did, because I think there's like 1 class every 6 months. So we started in January, and then there was another class that came in August. So she was 2 classes before me, and she graduated and got a position as a practical nurse in the OR, operating room, at the Children's Hospital as a practical nurse. You heard me. It's true. I'm not lying. I don't know what's going on in the States, because I know some of you guys are going to come for me and say that it's impossible and this and that and this and that. But where I live in Canada, I don't know how they're treating LPNs out there in the States, but it seems like all of you guys just need to come over here. Just come on over, and Canada's going to take you guys, because nurses are always needed. We get paid well, and we can work in a lot of places. It is a lot easier for RNs, if you are a new grad LPN and you're going against a new grad RN for the same position, chances are the RN might get the job before you. But as an LPN, it doesn't mean that you can't get hired in the places that you want to get. You just need to work a little bit harder, and you just need to be a little bit more patient. But if you guys know that you guys want a hospital job, try getting one as a CNA. Try getting into the hospital, work as an orderly, work as a CNA, and from there, once you graduate, you should be able to just show your license and switch over. Or even before you get your license, once you complete all your clinicals, you can work as a CP, so pending license nurse. And yeah, so I just wanted to break that myth. We are not confined. We are not glued to long-term care residences. It is false. It is a lot. If you are an LPN and you apply for a position in a residence, chances are you're probably going to get the job like that. But it doesn't mean that you can't get a job in a hospital. Like I said, you're just going to need to push a little bit harder. And if you want it bad, you're gonna get it. So don't let anybody discourage you. I'm tired of people trying to discourage my fellow LPNs, okay? You are important. You are a nurse. You are gonna get a job. You are gonna make good money. You're gonna live comfortably. You're gonna do fine. And if you want to continue, if you want to go further, people need to stop thinking that, like, if you become an LPN, it's like that's the end of the road for you and you can't go further in your career. If you want to become an RN later on, you can. And if you don't, well, don't. But guess what? At least you know that you're a nurse, you're saving lives, you're doing what you love, and you're making good money doing it. Not as much as RNs, but you're still making good money. Okay, so I just wanted to come on here and clarify that. I really hope you guys enjoyed this video. Don't forget to like, comment, and subscribe. And like I said before, any questions, anything that you'd like for me to clarify for you guys, leave them down below, and I will be more than glad to answer them for you. I hope to see you in my next video. Bye.